Good day, my name is Teacher JV, and today we're going to learn about your chapter 15. It's all about your respiratory system. Okay, so here, your respiratory system involves in all of our activities, with all the things that we do. This will start when we are still on our womb, after our birth, all throughout our life journey until our last breath. The respiratory system is involved. So are you guys ready? Okay, so we're going to talk first about the functions of your respiratory system. So the first one here is all about your gas exchange. So what is happening in your gas exchange? This is the process by which the oxygen and your carbon dioxide move between the bloodstream and the lungs. So this is the primary function of the respiratory system and is essential for ensuring a constant supply of oxygen in our tissues, as well as removing the carbon dioxide to prevent its accumulation in our body. Okay, so that is all about your gas exchange, supplying oxygen to the tissues of our body and removing the carbon dioxide to prevent its accumulation. Now, the second one is all about the regulation of the blood pH. So what is happening here, or this happens when the respiratory system alters the blood pH by changing the blood carbon dioxide levels. Now, this one will make it suitable for our blood or for our system. Okay. Now, the next one is the voice production. So the vocal folds produces the sound when they come together and then vibrate as the air passes through them during your exhalation of air. Okay. Now, this vibration produces the sound wave for our voices. Okay, we're going to talk more about that one later on. The next one, your number 4, is all about the olfaction. Remember, we've talked about this one already in your special senses. Okay, now the system consists of the nose, the nasal cavities, which in the upper part support the olfactory mucous membrane for the perception of smell so that we can smell the food that we are taking in. Okay, now on its lower part, it acts as respiratory passages. It is where the air passes through. Okay, so it is both for your special senses as well as for the respiratory function. Okay, that is for your olfaction. Number 5, it is all about the innate immunity. Okay, so inhalation is required for all people who are living. Okay, inhalation is required for our respiration and for our life. Now, this process is not without risk, as it is potentially exposes to person as well as to environment, especially right now during the pandemic times that we are being exposed to different kinds of pathogens and viruses, something like that. Okay, so this makes our upper respiratory tract one of the most vulnerable or common routes of infection, okay, which can lead to morbidity or mortality. Okay, and with this that is happening, or the factors that is we are facing, we are relying with our innate immunity in our respiratory system so that we can combat or we can battle these pathogens. Okay, and number 6 is all about your ventilation. In ventilation, or simply known as your breathing, is the movement of air through the conducting passages between the atmosphere and the lungs. Okay, so these are the 6 functions of your respiratory system. Now let's move here to the parts of your respiratory system, we're going to talk first about the upper respiratory system. Okay, and in the upper respiratory system, we're going to talk about your external nose or your nares here, and also your nasal cavity. We're going also to talk about your pharynx or the throat. Okay, now let's move here to the next. Okay, as you can see here, so this one, this is what we call your, this is the nose. We've talked about this one already in the special senses. As you can see here, this is the external nares or the nostrils. It is where the air will be introduced or will, it is the portal for the air for our body. And as you can see here, this is your septum, your nasal septum. And if we're going to move on the inner part, this one, this part here, this is what we call your choana. Okay, this is the internal nares or specifically known as your choana. As you can see here, it looks like a funnel, right? So this one, your choana, it extends from your external nares here until here. Now, the choana, as you can see on the upper part, this one, the roof part of choana, this is already your hard palate. Okay? So, this is all about the nose. Now, moving on, here, this is what we call your paranasal sinus, as you can see on this part. So this is your paranasal sinuses, and here are your concha. Concha is the singular, and the plural is your conchi. Okay, in paranasal sinuses here, as you can see, these are the air-filled spaces within bones. As you can see this one, here, this is where the air is being filled. These are inside your bones. Okay, so this includes your maxillary, your frontal, your ethmoid, and your sphenoidal sinuses. Okay, they are open into your nasal cavity and they are lined with mucus. Okay, now if there's an infection or there is an inflammation, we call that as your sinusitis. Okay, now a sinusitis, this can be treated with the use of antibiotic being prescribed by your doctor, more of drinking water, increasing your fluid intake as tolerated, or more of hydration. Next one is more of inhaling steam, so that we can treat your sinusitis. Okay, now moving on this part, we have your concha, your superior, we have your middle and inferior concha. Okay, now this conchae, on each side of your nasal cavity, this increases the surface of area of your nasal cavity. Now, what are the functions of this? It helps in cleaning, humidifying, and also warming the air. Okay, I guess we are clear here. Let's move here. We're going to talk about your nasal lacrimal duct, which we already talked as well in your special senses. So this one, they carry the tears from the eyes, and this is open in your nasal cavity. Okay, we also have the term what we call your sneeze reflex. This will dislodge the foreign substances from the nasal cavity. Okay, now moving on here, let's have a review on the functions of the nose. It filters airway for respiration. It involved in speech, olfactory receptors. It warms the air. And the last one is sneezing dislodges materials from nose. Okay, so as you can see here, whatever the form of your nose, you should always be proud of it. Okay, now let's move here. And the next part is what we call your pharynx or the throat. Okay, so the pharynx or the throat, this is the passageway for both your respiratory and your digestive system. Okay, as you can see here, the pharynx is subdivided into three. So we have your nasopharynx, your oropharynx, and your laryngopharynx. Okay, so with this one, if you're going to look closer here, your nasopharynx here, as you can see on this part, it is the superior part of your pharynx, and it is located on the posterior part of the pharynx where the air is being taken in. Okay, and as you can see, it is near your soft palate. So this one is your soft palate. It is adjacent to your nasopharynx. Your soft palate, it is a partition that separates your nasopharynx and your oropharynx. Now, if we're going to look down here, extending to your soft palate is what we call your uvula. It looks like grape or little grape, okay? This is the extension of your soft palate, your uvula. Now, as you can see here, we also have your pharyngeal tonsils on the upper part here. Your pharyngeal tonsil, this aids in defending against infections. We already talked about this one last time as well. Okay, now moving on to the next part of your pharynx is the oropharynx. Okay, as you can see here on this one, this is your oropharynx. So this one extends from the uvula to your epiglottis. Okay, this takes in food, drink, and also air. Okay, this extends from your uvula until your epiglottis. And as you can see here within this complex, you can have your palatine tonsil and your lingual tonsil. Okay, and the last part here, last part of your pharynx is your laryngopharynx. So this one extends from the epiglottis going to your esophagus. Now, food and drink pass through. Some air can pass as well, but too much air can result to belching or your pagdighay. Okay, so again, pharynx, it has three parts. Your nasopharynx, the upper part, the middle part is your oropharynx, and the last part is your laryngopharynx. Now let's go here. We're going to talk now about your lower respiratory tract, and we're going to start with your larynx. Okay, the larynx, or what we call your voice box. Okay, so as you can see here, your larynx is located in front of the throat, and it consists of 9 cartilages. We have 3 single, and we also have 3 in pairs. Okay, now the 3 main functions of your larynx is maintain open airway, protect the airway during the swallowing, and the last one is produces the voice. Okay, so let's talk first about the singles. So the first one here that we're going to talk is all about your thyroid cartilage. So the thyroid cartilage is also known as your Adam's apple, especially to boys or to men. That is your Adam's apple. Okay, and it is the largest part. And as you can see here, your thyroid cartilage is located or is attached here to your hyoid bone. Okay, thyroid cartilage is attached to your hyoid bone. Now, let's go here, your cricoid cartilage, this one, or this one, they're the same. Your cricoid cartilage, this is in the inferior side of the larynx. This forms the base of the larynx, and both of your thyroid and your cricoid cartilage maintains an open passage for airway movement. Okay, and the last one here that is single is your epiglottis. As you can see here, this is your epiglottis. So epiglottis, it is a piece of elastic cartilage. Okay, this one is elastic. Remember, epiglottis is elastic. And as you can see, it looks like a flop, right? And it's because it prevents swallowed materials from entering your larynx. Okay, so what are the three single cartilages again? We have your thyroid cartilage, your cricoid cartilage, and your epiglottis. Okay, now let's move on to your paired one. The paired one here. So we have the top portion or the top part. What we have here is the cuneiform cartilage. We also have your corniculate cartilage, the middle part, and the bottom part is your arytenoid cartilage. So all of them, they are 9. Okay. Now let's move here. Please do not be deceived by your eyes. This is the voice box and not the one that you are thinking of. Okay, that one is different. So this one, this is your vocal cords or your vocal folds. Okay, so this is the source of voice production. The air moves past them, they vibrate, and sound is produced. Force of air determine the loudness. The tension determines the pitch. Okay, so as you can see here, the white one here, that is the false vocal, here. The white one is the true vocal cords, and the one here, these are the false vocal cords. Now, if you're going to look at here, the true vocal cords is the one that is in triangular shape, just like that. Okay, so inflammation of vocal cords, that is what we term as your laryngitis. Okay, this is caused by overuse, by dry air, as well as infection. Okay, now let's move lower part. This is your trachea. Your trachea is also known as your windpipe. Okay, so as you can see here, it allows air to flow into the lungs, and it consists of 16 to 20 C-shaped pieces of hyaline cartilage. Okay, now smoking, coughing dislodges materials from your trachea. Now, smoking kills the cilia in your trachea. Okay, and if you're going to notice, to those people who are smoking for long period of time, they're developing what we call the smoker's cough. Okay, it's because their windpipe or the trachea is being irritated already, and the cilia there is being destroyed. Okay, now as you can see here on the lower part, this is what we call the carina. So this one will separate the right and the left bronchus. Okay, now let's move here. This is the how are we going to establish patent airway to those person who suffered from choking, or people who became unconscious. It's because of heart attack or any untoward circumstances. Okay, so the first one here, this is your Heimlich maneuver. I know you're familiar with this one. Maybe you watch it in television or movies, or maybe you experience doing it to someone else when someone is choked with food. Okay, so as you can see here, this is the proper hand gesture that you're going to put it here, and you're going to stand behind the person suffering from choking, so that you will apply a sudden pressure to the abdomen, which can force up to the trachea to dislodge the obstruction. Okay, this one here is being applied for infant. So this one is what we call the back blow, and this one is your thrust. Okay, on this part, this is what we call the intubation for the people who already became unconscious and cannot use its own body to have a patent respiration. Okay, so we are doing this one. We are intubating the client, and here, as you can see, we have here your cricothyroidotomy. Your cricothyroidotomy intubation is they're putting how do you call this one, an opening on the cricoid cartilage so that they can also have a patent airway. This is being done on emergency circumstances, especially when, when there are scarcity of equipment. Okay, and of course it is being done by a licensed or experienced doctor. Now here, moving on this one, this is what we call tracheostomy. Maybe you've seen this one already. Maybe your relative or in the movie or television. So your tracheostomy, it is an operation to make an opening into the trachea, and this one allows airflow and provide a way to remove secretions. Okay, and how are we going to do that? It is through suctioning, in which you're going to learn by the next semester. Okay, so let's move. Next one is what we have here are your bronchi. Your bronchi divide from trachea, left and right. It's divided here in your carina, each of which connects to the lungs. Now, the left is more horizontal because it is displaced by the heart. And this one, your bronchi, they are lined with cilia. They also have, they also contain C-shaped places or pieces of cartilage. Okay, here, maybe you already familiar with the whooping cough, or sometimes we call us your pertussis. Okay, so this is a serious bacterial infection of the tracheobronchial tree caused by your bacterium Bordetella pertussis, or we call B. pertussis. Okay, this can spread through inhalation of airborne droplets or contact with droplet covered surfaces. So with this one, that is why in the hospital setup, we always wear mask for this one. If you are taking care of a patient suspected of having whooping cough, it's because each newly infected person can pass it over 10 people. Okay. Now, after the incubation period, severe coughing will develop. It will be followed by a loud inspiratory pitch, high-pitched sound, or the whoop. Okay. Now, the coughing can last at least 10 weeks or more. So as early as newborn, or the children is being vaccinated with this one. Okay, now I can now move to the lungs. As you can see, the lungs are the primary organ for respiration, and each of the lung, they are cone in shape, as you can see here, and they sit here. Okay, they sit or they rest on our diaphragm. Okay, now let's move here in the microscopic part or lower part of, or the smaller parts of your lung. Right lung has 3 lobes, while your left lung has 2 lobes. Now, each lobe is divided into your bronchopulmonary segments. Okay, so in the bronchopulmonary segments, on the right side, we have 9. On the left side, we have 9 bronchopulmonary segments, and on the right side, we have 10. Okay. Now, let's move on here. Okay, so we're going to talk now about your tracheobronchial tree. Now, it consists of the main bronchi and many branches. So as you can see here, both on the left and the right, we have the main or the primary bronchus. Now, the main or the primary bronchus, it will branch out to smaller pieces, okay, until we reach the end part. Okay, so first, your primary bronchi or your bronchus, each of it will be divided into your lobar bronchi. The lower bronchi, or the secondary one, conduct air to each lung lobe. Okay? Now, after which it will branch out again to a smaller part. That is what we call your segmental tertiary bronchus. Now, your segmental tertiary bronchus, which lead to your bronchopulmonary segments of the lungs. Now, it will branch out again in what we call your bronchiole. Okay? After bronchiole, it will branch out again to your terminal bronchioles. Okay? Now, after that one, we still have more. Your respiratory bronchioles subdivides to form your alveolar ducts. Okay? Your alveolar ducts, there's are long branching ducts with many openings. Okay? Which can lead to your alveoli. The alveoli, these are the hollow sacs where air and blood come into close contact. Okay? Now, on the lower part of your alveoli, we have your alveolar sacs. Okay? These are the end of smaller alveolar ducts that are the breathing airways filling the lungs. Now, these airways or tubes divide and form 2 or 3 alveolar sacs at the end. Okay, it is in the alveolar sacs where the exchange of oxygen and carbon dioxide takes place. Okay, so again, let's have a quick review. So from the main bronchus, the primary, it will go to lower secondary, your segmental tertiary, your bronchiole, terminal bronchioles, alveolar ducts, alveoli, and alveoli sacs. Okay, I hope this one is clear so that we can move on here. So this one is here in the alveoli process, the gases that the blood carries to the lungs, expelling the carbon dioxide and letting the blood transport to the oxygen to the cells in the body while it is in the alveolar sacs where the process takes place. Okay, and the second one, that is what we call your respiratory membrane. Okay, in lungs where gas exchange between the air and the blood occurs, this is formed by walls of alveoli and also your capillaries. And alveolar ducts and respiratory bronchioles also contribute and very thin for diffusion of your gases. Now let's move here. Okay, this one, as you can see, this is a form of asthma attack. Okay, this is where the contraction of terminal bronchioles lead to reduced airflow. Now, if there is a reduced airflow in your terminal bronchiole, asthma may occur. Okay, now let's move in here. Now, in the layers of respiratory membrane, a thin layer of fluid from alveolus, alveolar epithelium or simple squamous, basement membrane of alveolar epithelium, thin interstitial space, basement membrane of capillary endothelium, and capillary endothelium, simple squamous. Okay, now let's have a quick air passages of the lungs. Primary bronchi, this one we already talked. Lobar, segmental bronchioles, terminal respiratory bronchioles, alveolar ducts, alveoli, and the last one is your alveolar ducts. Okay, now let's move here to the next one. We have your pleural membranes and cavity. So if we say pleura is a double layered membrane around the lungs. Okay, as you can see there, your parietal pleura. Okay, parietal pleura, it membranes that lines your thoracic cavity. While your pleural cavity, these are the space around each lung. Your visceral pleura, membrane that covers the lung surface. Okay, now the pleural cavity between your parietal and your visceral is filled with pleural fluid. Okay, now what's with this pleural fluid? It is important because it acts as a lubricant, okay, allowing both to slide past each other as the lung and the thorax exchange shape during your respiration. And also it helps hold the pleural membrane together. Okay, now moving on here, we have your ventilation. What is ventilation? It is the breathing. Okay, this is the process of moving air and out of the lungs. Okay, in which we're going to use our diaphragm. Okay, remember the spelling of the diaphragm, please. Skeletal muscle that separates your thoracic and your abdominal cavities. Okay, so again, this is the process of moving air in and out of our lungs with the use of diaphragm. That is ventilation. Okay, now the phases of ventilation, we have your inspiration and your expiration. In inspiration, we breathe in, uses our external intercostal muscle. In expiration, we breathe out. We uses also the internal intercostal muscle. Okay. Now let's move here. Pressure changes and airflow. So when the thoracic cavity volume increases, pressure decreases. When thoracic cavity volume decreases, pressure increases. Air flows from areas of high to low pressure. Okay. Now, in the inspiration, the diaphragm descends and the rib cage expands. Okay. Now let's move back here for a while. Okay, maybe here. So what is happening here in the inspiration, the diaphragm descends and the rib cage expands. Now, the thoracic cavity volume increases and the pressure decreases. So we have what we call your atmospheric pressure. The atmospheric pressure is greater than your alveolar pressure. Okay? Now, the air moves into your alveoli or in the lungs. That is during the inspiration. And expiration, the diaphragm relaxes and the rib cage recoil. The thoracic cavity volume decreases, the pressure increases. The alveolar pressure is greater than the atmospheric pressure. The air moves out of the lungs. Okay? Now here, okay, this is the lung recoil. What is this one? This is the tendency for an expanded lung to decrease in size. It occurs during quiet expiration due to elastic fiber and thin film of fluid lining in our alveoli. That is your lung recoil. Okay. As you can see here, we also have your surfactant. So what is surfactant? This is the mixture of the lipoproteins produced by the secretory cell of your alveoli, single layer on surface of the thin fluid lining alveoli. It reduces surface tension. It keeps our lung from collapsing. Okay, this is very important. Okay, especially to the newborn that they have a surfactant in their lungs already, so that they can, they can survive in the outer environment outside the womb of the mother. Okay, next one here we have your pleural pressure. What is pleural pressure? This is the pressure in your pleural cavity less than alveolar pressure. Keep alveoli also from collapsing. So what are the things that keeps our alveoli collapsing? Your pleural pressure, as well as your surfactants. Okay. Now this one, this is the alveolar pressure changes during inspiration and expiration. Please read this one on your book. Now here we also have your pneumothorax. So what is happening in pneumothorax? This is actually a condition where air collects in the pleural spaces, which are present between the lungs and the chest wall. Now it is basically a state where the lung collapses due to the leak air pushing from the chest walls to the outside of the lungs. Okay. We have the factors that influence pulmonary ventilation. The first one is your lung elasticity. Second is the lung compliance. And the third is the respiratory passageway resistance. So in the lung elasticity, the lung need to recoil between ventilations and decrease by your emphysema. Lung compliance, expansion of thoracic cavity affected if the rib cage is damaged. Respiratory passageway resistance occurs during an asthma attack or infection or tumor. Okay, now let's move here. As you can see, maybe you've seen this one as well already, or you're familiar with this. This is your spirometer. Okay, spirometer. This is the device that measures the pulmonary volume of a person. Okay. We also have these terms that you need to remember. We have the tidal volume, the inspiratory reserve volume, the expiratory reserve volume, and also your residual volume. Now, the tidal volume is the volume of air inspired and expired during quiet breathing. Your inspiratory, from the word itself, inspiratory, the volume of air can be inspired forcefully after a normal respiration. Your expiratory is the volume of air that can be expired forcefully after normal respiration, while your residual volume is volume of air remaining in the lungs after a maximum expiration. Can't be measured with spirometer. Okay? Your vital capacity, or the VC, this is the maximum amount of air a person can expire after a maximum expiration. So we have your vital capacity will equal to inspiratory reserve volume plus expiratory reserve volume plus your tidal volume. Okay. Now the lung capacity, the total lung capacity, or the TLC, will equals to your vital capacity plus residual volume. Okay. Now this illustration, this is the respiratory volumes and respiratory capacities. Please read this one as well on your books. So we have the factors that influence pulmonary volume. Of course, gender, if it's a male or female, age, if you are if you're a child, middle age or adult, the height as well, and also the weight. They all contribute they're all factors that can influence the pulmonary volume. Now let's go here. These are the terms that you need to know or you need to read. It's the first one is about the gas exchange in the respiratory membrane. So where gas exchange between blood and air occurs, primarily alveoli, some in respiratory bronchioles, and also your alveolar ducts. Now, in respiratory membrane does not occur in bronchioles, bronchi, trachea. Influenced by thickness of membrane, total area of membrane, partial pressure of gases. The next one is the respiratory membrane thickness. Increased thickness decreases the rate of diffusion. Pulmonary edema decreases diffusion. Rate of gas exchange is decreased, and O2 exchange is affected before your carbon dioxide, because carbon dioxide diffuse more easily than your oxygen. Okay, the surface area. The total surface area is 70 square meters, just like the basketball court. Okay, decreased due to removal of lung tissue, distraction from cancer, as well as your emphysema. Okay, let's talk about your partial pressure. So what is your partial pressure? This is the pressure exerted by a specific gas in a mixture of gases. Example, a total pressure of all gases is 760 and 21% of mixture is oxygen, then partial pressure for O2 is 160. Symbol is P, the pressure, and gas is your O2. Okay. Now, as you can see here, diffusion of gases in the lungs. Cells in body use oxygen and produce carbon dioxide. Blood returning from tissue and entering lung has a decreased partial pressure oxygen and increased partial pressure carbon dioxide. Oxygen diffuses from alveoli into your pulmonary capillaries or the blood, and carbon dioxide diffuses from capillaries into your alveoli. Now looking at this one, this is the illustration of your gas exchange. You can appreciate reading this one as you can see in the bigger picture on your books. Okay. Now, how about the diffusion of gases in tissues? So blood flow from lungs through left side of the heart to tissue capillaries. Now, oxygen diffuses from capillaries into your interstitial fluid because partial oxygen in interstitial fluid is lower than capillary. Oxygen diffuses from interstitial fluid into the cell with partial oxygen is less. Okay, as you can see here, this is the gas exchange in the tissues and also in the lungs. Please familiarize yourself with this one. You can see this one on your book. Okay, moving on here. How about the carbon dioxide transport in the blood pH? Now, the carbon dioxide diffuses from cells into capillaries. Carbon dioxide enters blood and is transported in plasma combined with blood proteins bicarbonate ions. Now, your carbon dioxide reacts with water to form carbonic acid, which forms your H, hydrogen plus bicarbonate ions. Now, carbon anhydrase, the RBC increases rate of your carbon dioxide reacting with water. Now, the carbon dioxide level increase, blood pH decreases. Okay. Now, let's go here. We're almost done. We're going to talk about your rhythmic ventilation. Okay. So the normal respiration or the RR, respiratory rate, is 12 to 20 per minute for adults. Okay. So if you're going to take this one in your assessment or taking your taking the vital sign of your client, you take it in a 1 full minute by observing the movement of the inspiration and expiration of the client. Okay, please get it in a 1 full minute. Okay, so your references is 12 to 20, that is normal for adult, while for children 20 to 40 is the normal RR or your respiratory rate. Now this one, it is controlled by neurons in your medulla oblongata. The rate is determined by number of times respiratory respiratory muscles are stimulated. We have here the term your pre-Botzinger complex. This is known to establish the basic rhythm of breathing, while your pontine respiratory group play a role in switching between inspiration and your expiration. Okay, now we have another illustration here. So this one is the respiratory structure in the brainstem. Okay, Now, the nervous control of the breathing, higher brain centers allow voluntary breathing. That is why we can breathe on our own. You know, we can control this one. Emotion and speech can affect the breathing. If you're scared, if you are on rage, too much emotion, you know, sometimes it will affect our breathing. Okay. And also the way we talk, sometimes if we are very fast in terms of talking, like, you know, we are gasping of air and the likes. We have here the Herring Brewer reflex. This is inhibit respiratory center when lungs are stretched during our inspiration. And as you can see this one, this is the nervous and chemical mechanism of breathing. How about the chemical control of breathing? Chemoreceptors in the medulla oblongata respond to the changes in the blood pH. Well, blood pH are produced by changes in blood carbon dioxide levels. An increase in carbon dioxide causes decreased pH. Result is increased breathing. Okay, so that is like the compensatory mechanism of our body. When there is an increased carbon dioxide, it causes the decrease in the pH of the blood, which resulting to hyperventilation or increased breathing. Okay. Now, the low blood level of the oxygen stimulate chemoreceptors in our carotid and aortic bodies, which can lead to the increased breathing. Okay. So as you can see here, another illustration. This is the regulation of blood pH. Please read this one on your book. And the last one here is kindly read the table 15.2, page 432, the representative diseases and disorders of your respiratory system. You can find that one on your book. Please be familiarized with this one, as we are going to use this one on your quiz as well as on your how do you call this one, on your exams. Okay. And that will conclude our discussion about your respiratory system. I hope you learned something today. Please, again, use all the resources that you can use in learning about our subject. Use the book, use your Connect, use the video attached in the Google Classroom so that you can understand well our concept. And that's it for today. I'll see you again next time. Stay awesome. Thank you.